Postpartum psychosis is a severe form of postpartum mood disorder that can affect someone soon after having a baby. Postpartum mood disorder are commonly divided into three categories: the baby blues, postnatal depression, and postpartum psychosis. This episode typically present as depression with psychosis that will interfering the daily activities within a few weeks of childbirth. It affects around 1 to 2 in every 1,000 deliveries. It is a severe mental illness and should be treated as a medical emergency. The patient will be hallucinating as one of the early symptoms. She will thinking that someone is watching her, and even worse will lead to suicide, the cause of maternal death, as the psychiatrist shared that when they asked the patient the level that she want to commit suicide from 1 to 10, she repeatedly said 9, 9, and 9. As life-threatening psychiatric emergency, it can give a significant adverse impact on the mother, baby, and wider family. It is important for us to recognize the woman at high risk and give a prompt treatment of women who develop the illness.
The symptoms of postpartum psychosis. First, hallucinations, which when they hearing, seeing, smelling, or feelings that are not there. Second, delusions, which when they are thoughts or beliefs that are unlikely to be true. They also have a manic mood that they talk and think too much, and a low mood that shows signs of depression, being withdrawn or tearful, lacking energy, having a loss of appetite, anxiety, agitation, or trouble sleeping. And sometimes they have a mixture of both a manic mood and a low mood, or rapidly changing moods. Other than that, they will feel suspicious or fearful, loss of inhibitions, and restlessness.
The causes. We are not sure what causes postpartum psychosis, but you are more at risk if you have these factors. Genetic factors. The most significant risk factors for postpartum psychosis are a personal or family history of bipolar disorder or a previous psychotic episode. Obstetric risk factors. Primiparity, pregnancy, and delivery complications, delivery by cesarean section, having a female baby, and a shorter gestation period. Changes in medications. Pregnant women with a bipolar mood disorder often has to come off mood stabilizers such as lithium, pre-conception, or in early pregnancy because of concerns over toxicity to the fetus. Hormonal factors. The role of several hormones, including estrogen, progesterone, prolactin, follicular stimulating hormone, and luteinizing hormone, has been considered, but the evidence towards them remains mainly circumstantial. Then, sleep deprivation. When the absence of sleep causes a disconnection from reality that can present as hallucination or delusional thinking. Immunological factors. Due to dysfunction or dysregulation of immunological systems, postpartum psychosis may play a part in it.
The first treatment is hospital admission. Postpartum psychosis is a psychiatric emergency. It can quickly become severe and vary significantly from hour to hour. Admission is usually necessary, even for women with the most supportive family. The NICE, National Institute for Health and Care Excellence guideline, recommend that women within a year of childbirth should be offered admission to a specialized mother and a baby unit. However, it may not be applied in Malaysia due to the limited of facility. Electroconvulsive therapy, ECT. The second option for treatment, if the postpartum depression is severe and the patient experiences postpartum psychosis, ECT may be recommended if symptoms do not respond to any medication. ECT is a procedure in which small electrical currents are passed through the brain, intentionally triggering a brief seizure. ECT seems to cause change in brain chemistry that can reduce the symptoms of psychosis and depression, especially when other treatments have been unsuccessful. The third treatment is pharmacology treatment, which is a medication that requires a combination of medications such as antipsychotic medication, mood stabilizer, benzodiazepines, which control your signs and symptoms.
Keeping your mind and body healthy could be part of your preparation. During your pregnancy, eat well, exercise, and practice stress reduction technique. Stay away from alcohol and caffeine after your baby is delivered. Continue to choose a healthy lifestyle. You are worried about postpartum depression? See your doctor earlier in your pregnancy or soon after giving birth. For women who have a history of mood disorder, particularly on the bipolar spectrum, imply a risk of more than 50%. Family history may not be as important for women who have never experienced psychiatric illness. At their antenatal booking visit, all women should be assessed for recognized significant risk factors. Women at risk should receive a formal risk assessment and management plan according to protocol. Women with schizophrenia are more likely to be admitted to the hospital after giving birth. The specificity of the childbirth trigger in schizophrenia, on the other hand, is still debatable. When compared to women with bipolar disorder, women with schizophrenia has a fourfold lower relative risk of admission in the postpartum period. Schizophrenia is a serious chronic illness in many situations, and women are often admitted for parenting evaluation or to help them cope with their newborns rather than for the acute onset of a new episode.